Hey guys, I'm Lauren Wake. I'm a fourth year resident and I am the chief resident this year. I am from Michigan. I went to Michigan State for undergrad and then Michigan State for medical school, and this was my #1 choice for a residency program.
My name is Mary Soka. I'm a third year resident in this program. I'm the outpatient chief resident. I graduated from Michigan State and I'm from Williamston, Michigan. I went to Ross University in Dominica for medical school.
My name is Omar Subani. I'm a second-year resident in this program. I'm from the Detroit area. I went to Michigan State for undergrad and medical school.
I'm Katie Kelly. I'm a second-year psych resident. I went to U of M for undergrad and Wayne State for medical school.
I'm Abram Davidov. I was born in the USSR, moved to the States when I was 5, lived in Michigan basically ever since. I went to undergrad at University of Michigan, and I went to med school at Oakland University of William Beaumont, and I'm super glad to be here.
My co-residents have been the best part of residency, I think, or one of the best things about residency. We are super cohesive, we always work together, we spend a lot of time together. They've been my major source of support during my time here in Detroit.
Alright, so what is my favorite thing about Detroit? Definitely the food scene. I like to eat. We have tons of great new restaurants in Detroit. They're popping up all over, and there's always old favorite restaurants where you can always grab an entree or dessert that you can really rely on.
I'm from here. I've seen the city kind of change in the past 10 years. There's a lot to do here. It's a good mix of like urban city and a lot of things to do in the suburbs.
If you're more into like the outdoors scene, then there's a lot of places up north, which is a little bit of a drive, but if you're willing to make it, I mean, the scenery is absolutely stunning.
What's also nice is probably half of our resident population lives in downtown proper, so you can literally call anyone and see if they want to join you for a drink, for a dessert, for a meal, whatever.
But I think right now Detroit is pretty exciting because it's going through this boom, and there's a lot of like renovations being done downtown, which is where I live.
So I chose this program for the patients and the faculty. I was lucky enough to rotate here when I was a medical student.
I first got exposed to this program through my third year of medical school. I rotated through Sinai Grace, and I didn't even have psychiatry on my radar, but the experience I had there, the teaching, the quality of like the attendings, the residents, really attracted me to come here.
I chose to come here because I heard that by coming to this program, you'd be someone who, when you get out into the real world, you're able to function on your own, you feel comfortable, and you've seen a lot of things, and you've gotten used to working on your own.
My favorite part of working in Detroit is the patient population. Detroit has a pretty vulnerable patient population. Some of our patients have trouble with transportation, there's increased incidence of mental illness, medical comorbidities, socioeconomic disparities, and our patients are resilient. They show up for themselves, and it's a privilege to work with them.
I got to see firsthand how nice and educational the faculty was. They really took our education into their own hands and made sure that we understood what was going on. You learn so much from treating this community of patients that I'm just really happy that we're able to experience that.
Attendings have been great. I think it's one of the major assets here. You get a very good variety because you get to work very closely with all the attendings, and you get a very good variety in how they look at patients, the way they approach it. A lot of them have a very strong background in psychodynamic thinking, and it's really expanded my own way of looking at patients. You learn to approach patients on many different levels, and I think that kind of clinical thinking cannot come from books.
Our attendings here are fantastic. We have some pretty well-seasoned attendings who have been working in the field for a very, very long time. We also have some attendings that are newer attendings who can relate a lot more to our experience as residents. Our attendings are genuinely interested in seeing us do well and to become better clinicians, but they also ask us about our day, our weekend, our travel plans, and they're just really fun to talk to.
I'm Dr. Jennifer Robinson. I'm a staff psychiatrist here at the Detroit VA, and currently I'm working on the acute inpatient unit. I supervise residents as well as med students.
Hi, my name is Anna Van Toy. I'm a psychiatrist on the inpatient psychiatry unit at the Detroit VA.
I'm a native to this area, and I went to med school at Wayne and did residency there, and then I stayed on. So that speaks to how much I like it here.
The VA is a really unique place to practice in that we do have a lot of chronic patients. We see a lot of SUD, PTSD, but we also have a lot of unique resources.
We're seeing a lot of psychosis. We're seeing even substance-induced psychosis, bipolar. So really the gamut of all of the acute psychiatric diagnoses that you would see on a normal unit. I don't think that anything is lost by us being the VA, because there are a lot of sick veterans who need our help.
We work as a very close team, not only me and the resident directly, but with the other attendings and the other residents, social workers and nursing.
Day to day, residents are usually either seeing patients independently or they're seeing them with the attendings. Oftentimes we do a little bit of staffing and recap after we've seen a patient. They will come up with sort of, what their diagnosis is, what are we working on, have they spoken with family members about collateral, and then what they think we should do as far as treatment. And so we collaboratively come up with a plan for patients here in the unit. I think it's a great experience to allow residents to work semi-independently, but have some of that support there with the attendings being right here on the unit with them.
I'm Gerald Shiner, and I'm the Chief of Psychiatry here at Sinai Grace, and I've been running the Consultation Liaison Service. I did all my training, and I've worked for my entire career in a general hospital, and I think it's very important to be working at the interface of internal medicine and psychiatry. We learn a lot about taking care of people who have physical problems or comorbid illness, and we see a lot of psychiatric issues in the general hospital. We see overdoses, suicide attempts, people who've had traumas, people who are suffering from illness, and people who don't take care of themselves. I've been attracted to that part of psychiatry, and I think it's important for our identity as doctors to remember that we are medical doctors in addition to being psychiatrists, and being able to take a history and share a life narrative with a patient is an important part of how we learn to do what we do and how we help people. This is the kind of educational program where anything a resident wants to do to further their education is going to be available to them. Working with a particular kind of patient, being involved in particular experiences, whether it's forensic psychiatry, whether it's dealing with patients with addiction, whether it's in psychosomatic medicine, we try to do our best to provide those kind of special experiences to our trainees so that they can be well-rounded psychiatrists. The emphasis is being on clinical skills as well as on the neuroscience of psychiatry. One of our trainees who went on to pursue a career in consultation liaison psychiatry and psychosomatic medicine came to me during the early stages of the COVID epidemic and during the quarantine, and decided that she wanted to work in the intensive care unit. So we were able to get 4 psych residents assigned to different intensive care units and working as part of the medical team doing liaison psychiatry. They did interviews with family, they set up family visits through Zoom and through FaceTime, they did death notices, they talked about end-of-life care with their patients, demonstrating how to do that for their medicine colleagues, and then being available to their medicine colleagues when they got discouraged or overwhelmed. So it's important to remember that psychiatry is more about the mind and learning how to talk to patients, listen to patients, and try to understand patients who have difficulty of living is the core of psychiatry and psychiatric treatment, and conveying that kind of emphasis is very important to the faculty here.
So as an intern, you have 6 months of psych and 6 months of non-psych. In your non-psych months, you have 2 months of neuro, 2 months of outpatient medicine, and 2 months of inpatient medicine. So far I've done a month of neuro and a month of outpatient medicine. However, I will say during my neuro month, I had a lady that presented with MS-induced mania. I mean, she was hyper-verbose, aggressive, there was paranoia going on. And it really just goes to show you that psychiatry is not limited to your psychiatric inpatient months. You're gonna see it all over, sprinkled throughout your entire career.
Second year, you go through all the specialties in psychiatry, like crisis, forensics, addictions, geriatrics, children's, and then you also do some inpatient months. But the highlight is call, being on your own, taking 24-hour calls.
This year I'm a PGY3, and in our third year we spend the majority of our time in the outpatient clinic seeing patients at both the Sinai Grace Outpatient Behavioral Health Clinic as well as the VA Mental Health Clinic.
This is my 4th and final year of residency, which is really exciting times for us. I have some core rotations that I have to go through: consult liaison, inpatient, psych at both hospitals, and then a couple others, and then we get to choose electives, which is fun. My first elective that I chose was a supervisory role in the outpatient clinic to get the PGY3s oriented to switching gears completely to an outpatient setting. Some of my other electives that I'm looking forward to are an eating disorder clinic elective, and then also some emergency psychiatry electives.
I am part of a fellowship in psychodynamics through the Michigan Psychoanalytic Institute, which actually several of my classmates are also doing this year. And I am our program's representative for the Michigan Psychiatric Society, which is the Michigan branch of the APA. That's a great opportunity to network and to meet residents and attendings from all over the state.
I come from a research background. You know, I did research in undergrad, I did research in med school. After a certain point, it sort of becomes a part of you, and I like doing research. This program is great because it doesn't require you to do research, but if you're interested in, like me, you have some opportunities. So we're doing TMS research here, which is really interesting. You have access to the DMC, which is like a big statewide center, and you have access to the VA, and the VA can provide you with national level data. You have access to Wayne State University, which is a large academic center, and you have access to the Wayne State Medical School, which I think is the largest medical school in the country. So you have a lot of medical students that are also ambitious and wanting to get involved in research. Dr. Blana is great because he'll get you connected with opportunities if that's your interest, and the sky's the limit, really. As much as you want to do, you can.
So candidates who would succeed here at DMC, they don't shy away from hard work. I would say that they thrive in the hustle and bustle of things and also pay very close attention to detail.
I'm Dr. Richard Ballon. I'm the program director of this residency training program. I'm also the associate chair for Education and Faculty Affairs and Professor of Psychiatry in this department and in the Department of Anesthesiology. I'm very glad that you're interested in our program because this is a very good and in a way a little bit unique program because you can get experience of different worlds and different settings. We are a place based in Detroit Medical Center, which is a tough place to be. You see different patient population, very interesting, very difficult one. Yet when you learn how to handle it, you're going to be really competent to do anything. But we are also an academic department with a lot of research, in different areas, and with a lot of good faculty, which is interested in teaching and can teach different things, whether it is clinical psychiatry, substance abuse, research, methodology, and different things. I, over the years, always felt that the greatest asset of these programs actually are the residents. I have to say, we have 4 great classes. I've been really happy about it. These are young people I really appreciate. I love to work with them. I do a lot of teaching myself, and it's a joy to teach for me and for many of our faculty. We are looking for people who are deeply interested in psychiatry, who are willing to learn in different environments and on different patient populations, and who are really good in working with our residents and with our other classes. So let's hope that you, based on the experience of listening to other people, our residents, and seeing whatever we have to say, are going to be attracted to our program, and I hope to see you soon during the interviews. Thank you very much.